Hello, my name is Dr. Latasha Headley, and welcome to Public's live platform. I am your host for today's show on organizational impacts of telework and public health initiatives alongside my co-host and co-founder, Dr. Ndukaku Amalu. As we continue to navigate through COVID-19 and take necessary precautions to remain safe in the workplace, many companies have had the opportunity and tools to move to a telework culture. With that said, Public wanted to talk about organizational telework impacts as it relates to public health.
Public is all about raising awareness on local and global public health issues to promote evidence-based discussions on public health. Our platform provides substantiated information and practical approaches to address public health issues. To stay updated, please register on our website at www.public.org. Follow us on Instagram at instagram.com/public or Facebook at facebook.com/thepublic.
Now we would like to introduce our two presenters. For our first presenter, it's Ms. Vincia Josephat. Vincia Josephat received her BA degree in communications from the University of Tampa and went on to obtain her master's in education management with a concentration in finance. She is currently obtaining her PhD in organizational leadership, and her study focuses on organizational telework. She has worked in the corporate financial and training field for the last 15 years, researching and evaluating process improvements and implementations, as well as developing training and content materials. Her expertise includes organizational program and policy development, as well as compliance and audit review.
It is our pleasure to also welcome Deborah James. Deborah James has worked as an educator and a learning development thought leader for 16 years. She is currently a learning and development government consultant with the Department of Veteran Affairs. Ms. James worked with the Department of Defense in the implementation of new electronic health records. Ms. James holds a master's degree in management from the Embry-Riddle Aeronautical University. She is currently working on her doctorate of management in organizational leadership at the University of Phoenix. I will now turn it over to Dr. Headley.
Thank you. So for today's discussion, we will be addressing the following questions. We will first, open up and talk about what the meaning of telework is to our presenters. We will talk about the pros and cons, and these are based on literature that they've reviewed for each of these categories, which is leadership, performance, employee satisfaction, life-work balance. Then we will talk about how telework informs organizational best practices and what are the best approaches professionals can use to effectively apply and approve successful telework environments. And then we will conclude with our open discussion. So let's get started. We will first, I will ask Ms. Josephat to define telework.
Absolutely, and thank you both for having me. I appreciate you allowing us in this platform. It's exciting to be able to talk about telework because it's definitely something that is a hot topic based on COVID-19. So thank you for having me. As far as telework, it's actually the ability to complete your duties, responsibilities from work away from the standard office. This is typically at a home-based office, but it can be anywhere outside of the United States, inside of the United States of the work office. Some organizations offer what's called a pop-up site where employees are able to go to work at that location, and it is closer to their home, but it's offered for flexibility reasons. As far as COVID-19, it actually has opened up a world of thought for telework. This current pandemic is the reason why telework is trending right now. It began in the 1970s due to an oil spill, and in 2010, Obama passed an act enabling federal employees to work from home. But today, organizations are using it so that they can keep their business going and afloat. So the future of telework is that it's here to stay. It's a love-hate relationship, right? based on COVID, the pandemic, it has opened up our eyes when it comes to telework, but it also allows us to continue business as usual. So COVID, lots of deaths, but it also, there is still a way for organizations to keep afloat. So this is the way that they can do it, is through telework.
Thank you for that, Ms. Josephat. Very good. We will now move on to our next question. Let's talk about the pros of telework, and then I do ask that after you finish your pros, that you also go over cons.
So let's go ahead and begin. Pros of telework. There are many. So we're going to break it down. It's based on leadership, performance, employee satisfaction, and life-work balance. So let's start with leadership. From an organizational standpoint, telework is cost-effective, right? Organizations are able to save on their bottom line based on their operational costs. It benefits them when they're able to allow telework. From a collaboration and communication standpoint, it also benefits from a leadership standpoint because it helps to encourage that open line of communication with employees. The team, normally they're linked digitally with apps such as Microsoft Teams, Zoom, and they use this to communicate on a daily basis. So employees are also able to connect as far as learning unique talents. So employees committed and leaders are able to use their level of talent to see things that they have not seen in the office before. So they'll be able to use that. From a performance standpoint, productivity-wise, they can use this as both a pro and a con. Literature reviews show that employees have a higher level of productivity because they focus better with fewer distractions. It can also be a con because they're less accountable for their actions. So it may take them a little bit longer for them to complete a task. Uninterrupted work time, this encourages multitasking. Again, employees are able to have fewer distractions, so it's easier for them to focus and easier for them to complete numerous items at the same time. As far as employee satisfaction, employees are given flexibility. So literature shows that there's an increase in flexibility. Once there's an increase in flexibility, there's an increase in productivity. Genuinely, it works off of that concept of you scratch my back, I scratch your back. Self-management is that freedom to work at your own pace. So employees are able to do that. That's definitely a pro because instead of having someone micromanaging you and ensuring that this gets done constantly on a daily basis, you're able to set your own terms, get your own flexibility. Work-life balance is one of the biggest pros as far as literature review is concerned. When it comes to telework, an employee has the ability to, of course, walk away whenever they feel that level of stress, whenever they feel overwhelmed. It's encouraged to walk away. They can regroup and come back so that they can come with a clear state of mind. As far as a flexible schedule is concerned, who doesn't love a flexible schedule? I know I do. So you're able to work in the comfort of your own home. You're able to let your guards down a little more versus in office. It's always business as usual. At home, you're able to complete the business as usual, but at your own pace, your own schedule.
Thank you for that. Ms. James, would you like to add to this?
Yes, sure. Thank you, Vintia. And to your point, there are many benefits to having telework within an organization. Microsoft Teams was launched in 2017, and since then there has been so many improvements made to help enhance the environment for telework, to support the collaboration and communication between team members and leadership. With those benefits that come along with telework, it's important for leaders to use these virtual platforms to implement the communication and collaboration and to increase performance. And this helps with the productivity of not only leadership, but as well as the team itself. For an example, leaders should be responsive and supportive to help develop the trust in a virtual team. Team leaders should also encourage everyone to respond promptly to requests from their teammates. It is essential also to take the time to provide that substantive feedback so that it is an optimal experience for your team members, and also proactively suggest solutions to problems the team is facing to help maintain that positive and supportive tone in communication and collaboration.
Thank you for that, ladies. We will now move on to discussing some of the cons of telework. Ms. Josephette, can you please start us off?
Absolutely. So with the good, there's always the bad, right? We also have some cons that goes along with telework. So based on the literature review, we'll go ahead and discuss some of these items. Following the same variables from the pros, we'll talk about the cons. So from a leadership standpoint, resistance. Leaders have a tendency to micromanage, which negatively impacts employees. Misconceptions. Leaders bring their high level of fear. So by this, I mean that if they feel they cannot see you and they don't know what you're doing from a minute-to-minute basis, then they fear that productivity goes down and you're not contributing. They also alienate employees, meaning that they're failing to properly engage employees as they work remotely. So it doesn't mean that because I am working remotely and I don't reach out to you, means as a leader, you cannot reach out to me, and just make sure that everything's okay. This is important because you are working from home. You're not on a face-to-face basis. So just making sure that your employees are okay on a, don't have to be every minute, but just engaging them so that they don't feel alienated, lonely by themselves is extremely important. From a performance standpoint, employees can be looked at as a form of procrastination. The literature review actually shows this as one of the most biggest cause as a con for telework. If you have no one to be accountable to but yourself, sometimes productivity may go down. Second, with performance would be time management. Likewise, poor time management skills will leave you with an unsuccessful day, goals not achieved, and this could be problematic for both the employees and the employer. From an employee satisfaction standpoint, time management is also a con because poor time management negatively impacts productivity. Feeling of loneliness, you have no one really surrounding you. At work, you have like-minded people. You are able to run ideas by them. When you're home, you're pretty much on your own. Therefore, the feeling of loneliness is actually a con for telework. And employees often feel overlooked for advancement opportunities. Leaders often overlook employees when at home for growth opportunities due to this out of sight, out of mind frame. This is actually one of a major con for telework as well. So let's focus on health, right? Work-life balance. One of the cons would be overwork. When you are in your office space, chances are you get up, you go to lunch, you move around, and you do things that will allow you to get your blood circulating and moving. In a home space, I am myself included, I've actually had to carve out some time to walk away and, go walking, getting some fresh air and coming back, because employees, when hours are concerned for work, it can encourage poor health. You sit at your computer day in, day out, you really don't have too much to do except the work that's in front of you. So we definitely want to encourage workers from home to get up and move around. Burnout is actually also one of the higher cons when it comes to work-life balance, because you are again in front of your computer on a daily basis, hour after hour, and it can become redundant. So if you're not conscious to actually step away from your computer to do things, it can definitely impact. Burnout is the number one driver for turnover, according to literature.
Thank you, Ms. Josephat, for that. Ms. James, what are your thoughts on cons of telework?
So I definitely agree with Vincia. There is a delicate dance between having a work and life balance. Not being in the standard office space can present some unique challenges. So for leaders and employees, whether it be, the individual that, whether there's resistance or, different misconceptions, alienated employees, those type of issues present a decline in employee satisfaction, which in turn hinders the communication, the productivity in this telework environment. And Vincia, to your point, when employees are not satisfied with a particular leadership style, whether it be micromanagement, they can develop those incongruent relationships or resistance with leadership. So I definitely agree with you on that.
Thank you, Ms. James and Ms. Josephat. So considering the pros and cons that you both have gone over, I would ask Dr. Amalu, please, let's discuss the public health portion of this as it relates to telework.
Yeah, thank you, Vincia and Gabriel, for giving us high-level detailed information regarding the organizational aspect of telework. That's good. So what we're doing here in Public, we know this telework is here to stay. It's not going to go anywhere. But what we're doing here is to shine some light on possible, potential health impacts relating to telework. Okay. We know also that no system is perfect. Nobody can ever come in and say, this system comes out is the perfect system, nothing is going to go wrong. That's not going to be true. And also, telework may not apply to every work environment. So we want our audience and the organization to take some, information back, why they develop policies to keep some public health aspects into consideration. Here in California, the state of California actually developed policies and procedure guides for state supervisors and employees. So if you want to get this information, we're going to also post it in Papali. You can get this information at calhr.ca.gov. So this has been in progress for a while. COVID-19 is just what you can say that just undressed all this whole thing and made it popular. But a lot of federal government has been implementing telework, like they just said. Now, the information I will be providing is based on literature reviews. Many experts suggested that leadership commitment, performance-oriented culture, and the 2010 Telework Enhancement Act played significant roles in enhancing federal telework satisfaction. And this was by Juan and Juan. Now, we can also look at the public health impacts of telework. It's something that epidemiologists and public health practitioners will continue to explore, though there are substantial evidence that one, telecommuting or telework risk varies by telecommuting environment or intensity. For instance, according to Hank, non-telecommuters or teleworkers were at greater risk of obesity. Now, this is one also saying that non-telecommuters, non-teleworkers were at greater risk of obesity, alcohol abuse, physical activity, and tobacco use. They also showed that employees who telecommuted or teleworked less than or equal to 8 hours per month were significantly less likely than non-teleworkers to express depression. But pay attention to their study. They said less than or equal to 8 hours per month. When we roll out telework now, in many cases, it's not going to be about 8 hours per month. People will be consistently working. So you have to account for that consistency of teleworking, what does it do to your body? People, for example, that ride their bike to work. Now they are now no longer going to ride their bike to work. They're going to actually stay home and work. So now, for people to do that, I would suggest find time during your telework to do that riding bike and come back and go back to your work. But again, it's easily said than done because it's hard, because people are already in a routine. They, wake up, take shower, ride their bike to work. That's their physical activity. Though they also, I'm still talking about Hank et al. 2016, they also concluded that there was no association between teleworking and stress or nutrition. Now, during this COVID-19 crisis, there's an author, Oakman et al. They concluded that telework will become a normal work practice and thus suggested that organizations should work towards developing telework policies and procedures. So again, like I said earlier, like Vincia and Gabriel said, telework is not going to go away. It's something that now a lot of organizations will incorporate and it becomes part of their usual activity. Now, if we now look at the disadvantage of this telework, we have to also consider public health perspective in relation to, again, I will repeat this, overweight, obesity, not even just overweight and obesity. What would be the directional pull to what we currently have in terms of overweight prevalence, obesity prevalence? What would be the pull to pre-diabetes? Because you need to understand that overweight and obesity, those are linked to diabetic status, pre-diabetic status. And then you consider mental health. What does working from home in some cases or maybe many cases due to people? We don't know. That is something that studies have to continue to explore. Also, like I said, physical activity or inactivity, burnout, work engagement are some negative effects of telework that should be consistently monitored. For instance, there's an author, Vendor et al., published an article in 2017, and they suggested that social support from colleagues or co-workers, employee participation in decision-making, employee tax autonomy, and employee work to family conflict environment were directly associated to work-related well-being, while the extent of telework was indirectly related to well-being via social support. They also concluded that regardless of telework, they emphasized that good or healthy work environment is important. So whether you telework or do not telework. So now, if we're going to move towards telework, people need to understand that you need to look at your work environment. Some people, for example, might be working from home and they might be in the habit of wake up, brush their teeth, and then sit on the bed, get their computer and work. Now, this is aspect of ergonomics. So the organizational aspect is that they have to write a procedure to make sure that their employees have ergonomic work environment for them to be able to function, and you need to be able to take some time out, not to overwork, take a break, go out and, some date or something like that. Just get that done and visual cue. That will help a lot. So this is one of the ways to make a meaningful decision and improve informed decision-making process by actually knowing the possible health impact associated with telework. Now, another author is Reese et al. They also concluded that public servant teleworkers express negative effects, including greater professional isolation and less organizational commitment on the days they work entirely from home. They suggested that working from home did not affect work engagement. Again, we have conflicting evidence from researchers. Some people mention how telework is positive and telework is negative. Again, knowing all the possibilities is always good for organization. I know at the end of the day, organization bottom line is always supersede every other thing, but we are living in the world of informed decision-making processes. We should know all this stuff. And Reese it also concluded that higher leadership member exchange reduced the impact of teleworking on professional isolation. So again, it comes back to work environment. So if you have kind of a crappy work environment, a very bad leadership, you can get away from that face-to-face, but it's reminding us that, telework is good or maybe good, very good, but we also have to understand the culture of that work environment to be able to make optimal benefit from it. Because at the end of the day, we weigh the cost versus the benefit. If the benefit outweighs the cost, then it's all good. We will just manage the risk. So, and I think all organizations should do this assessment. And in some cases, it might not apply to all work environments, and it depends on that organization to make the judgment. But leadership member exchange is a theory of leadership style, and it comes with three constructs. Role taking, which is assuming a role, and role making. In role making, you have in group and out group. And then the third one is routinization, which is establish a specific role for your employees. When you have an in group and out group, that also affects performance, that also affects efficiency in work environment, regardless of whether you're working from home or not. So it's always good to make sure that the leadership plays a crucial role. And that's what Everest itself is emphasizing. It's not saying that telework is going to go away, but it's driving us back to pay attention to the organizational culture that will help inform a better decision-making processes on how to develop effective telework environments.
Thank you, Dr. Amalu, and thank you, Ms. Josephat and Ms. James, for your contribution on pros and cons of telework. Just to add a little bit to that, there has been a study before COVID in 2018 by the Office of Personnel Management. I'm focused on federal employees when I'm talking about this. And about 76% of teleworking employees reported high performance ratings compared to 72% of non-teleworking employees. Also, anywhere from 75 to 79% of employees who participated in one of the teleworking programs said that they were actually happy with their jobs, which adds to their performance ratings going up, right? And that was compared to 67 to 72% of federal employees who didn't engage with any teleworking programs. And then in 2019, the telework, so we will say that tracking actual cost savings in the federal government is uneven and ad hoc. But according to the 2019 telework report to Congress, 54% of agencies did indicate that telework program achieved a cost savings. So they have been, and they will continue to look into telework. We deal in different federal agencies and environments where we have old school, what I call old school button seat type people, and they don't embrace change. The pandemic has forced a lot of the change. I've heard both sides say, I can't get into, we're using Zoom, we're using Teams and different things. And now some of them that were, I don't like this, I want to be back in I said classroom, but that say they want to be back in, their environment are now saying, and they're reporting at all hands meetings to the colonel, my staff is doing great. They're pushing for 100% remote post a pandemic. So it's very interesting how I feel like these reports to Congress will only go up, rather than drop, and would be in more of a positive light than a negative light in the future. But thank you. We will now move on to talking about telework and organizational best practices. Ms. Josephat, would you like to lead us on that?
Absolutely. Thank you. So there are a number of organizational best practices, one of which would be to understand the value of change. And as Dr. Umalu specified, you have to know your culture. And in that culture, there will be change. So that's one of the best practices from an organizational standpoint. Another is to be able to find ongoing support. So from a health standpoint, it drives home mental and physical health, right? Organizations are now putting in place support counselors for employees for their health and wellness. So that's definitely that's a best practice from an organizational front. And lastly, creating a fair and equal organizational environment. It's only good and fair for organizations to put this in place, to have maybe an HR in place or something to where employees know that they're not alone. They're able to reach out if they're having any issues of any sort. So based on these items here for best practices, it will drive these items here. So there's a decrease in employee absenteeism by 60% based on literature. There's a decrease in employee turnover by 20% for telework. There is an increase to promote business continuity, and that increased by 68%. And there's a decrease in employee recruitment and training costs. Definitely a plus for organizations, and that is at 54%. So all in all, organizations are looking toward telework. It may not be something that they will do on a 100% basis where 5 days out of the week they'll decide that they're going to do that. However, I do see, based on the literature that I've reviewed, that it is something that organizations are open to because they're able to continue business as usual, and you don't have to be in the office space in order to do that.
Thank you, Ms. Josephat. Ms. James, what are your thoughts on this?
So I definitely agree, along with having telework, it's important for organizations to create that buy-in. As you mentioned earlier, Dr. Headley, we're kind of forced into this telework environment. So it's important that you're checking in on your employees. You're providing them opportunities, whether it be health and wellness. It could be, I know like for my administrative team, we have weekly check-ins where, we put business to the side and we're thinking about like, well, how are you? How's your family? So those are definitely important aspects to incorporating into that telework environment. Also remembering that, telecommunication and those leadership strategies, those are critical aspects of job satisfaction, and having that ability to impact the behaviors of the virtual employees, whether it be that buy-in or, making those considerations that support the employee.
Thank you for that. That was very good, Ms. James and Ms. Josephat. We'll now move on to, let's talk about some best approaches to improve a successful telework. I heard when Ms. James was talking, she did mention a key one to me is how your group checks in on each other, and that really taps into one's mental health, and just to gauge, how employees are doing, because I think that is very important. You don't know what's going on in someone's mind, or, they might just want someone to simply say, hey, how are you doing? That's what we usually do in the office when we pass by people. Hi, how are you doing? And they're missing that. So, it's really interesting how even with the telework, we have to always remember to be thoughtful of other people and considerate and do all those things. But I will now turn over to Ms. Josephat to talk about. Thank you.
So best approaches to improve a successful telework. So I have listed a few things. These are mainly personal to me, so I'll share them with you. From a telework standpoint, I like to plan ahead. So I look at my week, I see what's happening, and I'm able to jot things down to be ready for the week. Especially because I'm here by myself, I'm able to get my thoughts together and know exactly what it is that I'd like to do. That helps quite a bit. Communicating clearly is another. I like to do that because when you are face to face, you're able to have that feel of I can see you. You kind of understand where I'm going with this. But teleworking, you're over the phone, or you may be in Zoom. You may not be sharing your screen or have your camera on. So it's very important to be able to communicate clearly and effectively. Next would be set reasonable expectations. This is a big one for me personally because with telework, because I'm home, I'm able to say, okay, well, I'll just sit here and I'll not, do my content reviews and I'll take care of them very knowing each one of would be a two reasonably I would not be able to meet that expectation. So just being honest with yourself and knowing what it is that you can and cannot complete. Effective teamwork. You have your team with you and they are here to support you. So go ahead and be that person to reach out, see how it's going. According to Miss James, just take a moment, see how your team is doing, and just communicate with them effectively. Remember to take a break, walk away whenever you feel overwhelmed. Definitely something to do, and learn to balance. That's a big one for a lot of telework employees because, as I've mentioned before, we like to say we're going to get all of this done in 8 hours' time, and 8 hours will come and go. You wouldn't take a break, you wouldn't eat. 10 hours would pass and you're still in front of your computer. So there's a fine balance between work life and your home life. So those are my best approaches to improve telework.
Thank you for that. And I know, like, just an example of an approach that we have is usually once a week on a Friday, someone leaves on a Zoom for anybody who wants to come. You can bring your family, whatever. And we do, it's a 10-minute deep breathing meditation. And it's led by a lady who does these kind of classes and stuff anyway. And I actually did it with my kids, and it was really like, because they're virtual, I'm virtual, we're stuck in this together, and it does help. People always say, oh, deep breathing, but it actually does work, and it puts your mind at ease in a different place, a different space for that 10 minutes. And I just feel like renewed and refreshed to finish my day out. And it's nice for a Friday to decompress everything that you've absorbed Monday through Thursday, which are like typically an employee's heavy days of working. Ms. James, would you like to add to this or?
Yeah, definitely. And thank you for sharing. That actually just brought to mind my team has developed a committee that is bringing fun back into telework. So on that committee, and from this conversation, I almost want to join the committee now because it's almost thinking of activities that we could do as a team outside of, the telework, because there is, a need for that balance in order to be productive. In telework, you can almost burn from both ends, whether it be, with life or with work in itself. So those are definitely important things to, definitely important approaches to take in order to be successful in that environment. Telework is definitely the future. It's here. It's definitely not going anywhere. Many businesses are transitioning from that brick and mortar presence to adopting a more virtual presence to conduct those daily business operations. So, and research is also showing that organizations almost benefit more by investing in those virtual teams. So I definitely say, as leadership, as team members, doing what it takes to make it a beneficial experience, not only for the employee, but for, the organization. So thank you.
I just want to add that the best practices must also be inclusive of the health measure aspect of telework. So I hope that many organizations that focusing on telework have to incorporate that piece, because to be honest, as you get healthy people into your organization, that actually leads to high performance. So that will be a very good one to also for any organization to look into.
Thank you for that, Dr. Amalu. We will now I open up for the speakers to do their closing. We'll start with Ms. Josephat, and then we'll follow by Ms. James, and then Dr. Amalu will close us out and open us up to our healthy discussion.
Thank you. With telework, I have been given the opportunity to review a lot of literature and research. And to Dr. Omalu's point, it comes with good and it comes with bad. So it's the pros and cons for every situation. With telework, though, I think it has, and the onset of COVID-19, it's opened the eyes of a lot of organizations so they would understand that we it's not necessary for you to be in an office space every day, Monday through Friday. Um, it is also based on the Obama's Enactment Act of 2010, also to allow employees to work from home just for that flexibility. And that comes from um, keeping your employees satisfied. That comes from encouraging a healthy work-life balance. And it also comes from the organizations being able to save on their bottom line. So it's a win-win for both organizations and employees.
Go ahead, Ms. James.
And I just like to add, as Vincia mentioned, it does help if, organizations and employees are working together to ensure the benefit of both. Because subsequently, once there's a benefit for the organization and the employee, that is, it supports them. It makes the employee feel supported in that environment, and it definitely creates a win-win situation.
Thank you for that. And Dr. Omalu, bring us home.
Yeah, so thank you, everyone. Telework is here to stay. It's not going to go anywhere. But that also provides us the opportunity, public health experts, epidemiologists, organizational leadership, to also always connect organizational decision to health. There's a connection right there. There's a bridge right there. And we know that sedentary behavior leads to overweight, obesity, hypertension, cardiovascular disease, diabetes, prediabetes. All these are what we know now that we're fighting in public health to try to reduce the prevalence of this condition. Now, rolling out telework to all organizations, again, is something that we really, really need to pay attention to when we develop all these policies and procedures to make sure that the public health aspect, the epidemiologic aspect is well woven and integrated into the telework policy so that people have that time to go out and physically become active to make sure that they're not overworking themselves to create more stress. So I believe that this is a good thing, but this could also be a very bad thing if we did not plan very well. So I think moving forward, knowing what's going on right now with COVID-19, I think it will also lay out the ways for us to be active about rolling out telework and making sure that everybody's safe while doing that and everybody's aware of the possible negative effects. But also one thing I'm thinking that I don't know how to address it yet is the equity, because telework will not apply to all work environments. How do we rebalance that scale so that people don't feel like, other people are working from home, I'm working from the office. So as we go on, it could be able to fix itself. But right now, it looks good that a lot of people are happy, but there's what you call exhaustion. As you continue doing something, it becomes boring. And once it becomes boring, it starts having negative effects. So we need to pay attention to that.
Thank you all for that. I just want to say on behalf of Public, we do thank and appreciate our presenters, Ms. Vincia Josephat and Ms. Gabrielle James, for joining our platform and speaking on this topic. With that said, we will now open up the floor to have our healthy discussion with everyone that is here and would like to participate. Thank you. So does anyone like to say anything, or you can also utilize the chat to write your questions or comments. and I'll just read them for you. Thanks.
Teresa. Hi, everyone.
Teresa?
Yeah, thanks for putting this together. It's amazing. I've not been able to attend, but to say the least, this is awesome. And I listen attentively, and I thank you all for coordinating and putting this together. It's just the trend today, and I hope this can expand to other organizational settings because it's a topic highly needed. And for me, the benefit is tremendous. And not only on a personal level, but it kind of broadened my understanding to many areas. However, I think Dr. Mello mentioned that his last comment that it may not be applicable in all work settings. And that is to say, like in clinical setting, individual on front line, or being burned out, or physician in ER, to name but a few. So I think the essence of expanding beyond the traditional work setting, if I may put it that way, which is Monday through Friday, go to office, 9 to 5, come back home, should be expanded to find some leverage with individuals who provide direct care. And this is per se, could they go to work a few days a week and find some aspect of their job being through telemedicine or telehealth? That's the only comment I have. Thank you so much.
Thank you so much
Teresa,
for raising it up. And the telehealth aspect is where the medical aspect comes in, and you are absolutely correct. Due to COVID-19 now, many health medical centers and health organizations are switching. You know, they're already doing telehealth at certain level, but with COVID-19, it went up substantially. So that's the way to go. You're absolutely correct.
And Teresa, we will be covering, that is a topic on our list of things to actually dive into the telehealth aspects. So stay tuned. Popolic is going to be on it too.
Hello, this is Florence. Can I ask a question and also make a comment, please?
Sure, go ahead.
Yeah, I didn't quite follow the area where Dr. Mello discussed a balance between work and personal life in reference to telehealth. I know telehealth is a new innovation, given what is going on right now with the pandemic. I think is a very interesting aspect of providing services to the patients through clinical practice. But in a nutshell, the people working from home who work, let me say, 8-9 hours a day, it's quite stressful to be on those computers all day, 5 days a week. I know they have the weekend to do other things, but what indeed can you suggest that will help those who work long hours Monday through Friday to balance work and personal life? Because telehealth is very stressful, and we know stress causes a lot of medical problems, even such as cancer, headache. It goes on to diabetes, hypertension, and things like that. So what can be done practically on a daily basis to balance work and personal health? Thank you.
You want me to take that?
Yes, please.
Okay, so I think that's a great question you just posed. And I think that there's no one answer that solves the whole problem that you just mentioned. I think the best thing is for each organization to look at their culture and see how they can change the culture or traditional culture of how they do business post COVID-19. They need to change that. Change is necessary, but most of the time change is very difficult because people don't want to change. And especially when it comes to organization, where many times the bottom line is most of the key thing they're focusing on. But you mentioned it very clearly. Stress is one of the precursors of most of the chronic conditions. Even when people are highly stressed, it affects infectious disease because it lowers your immune system, so you're not free from that in either way. So I think if I'm running an organization, I will look into that in terms of making sure that maybe I can create a shadowing. Maybe some people would be shadowing while others are working, through telework to be able to shadow somebody else. Our tradition in clinical setting, like 12-hour shift, is another problem. So I don't know how the medical fields or medical need to reevaluate how they put in so much hours and how it's actually impacting their life. There's a lot of studies out there already for this, but I'm hoping that also government can play a role in actually mitigating those issues somehow.
Yeah, and I was going to ask Ms. Joseph and Ms. James if they had anything else to add to that.
Oh, absolutely. I think that it is important, as Dr. Umalu has stated, for organizations to look into their culture to verify which aspect of this. But it's also take to be accountable and know when you're feeling stressed or know when you are overwhelmed. At that point, it is very important to walk away. It's also important to take your scheduled breaks and lunches. For some reason, when I first started working from home 100%, I felt, oh my goodness, I have to do everything. And I stayed at my computer. I took my lunch, I got my lunch, worked at my computer, and I became a victim of being tied to this computer for 8 to 10 hours on a daily basis until I realized my vision was affected. I felt tired. I wasn't moving around, and I'm a very physical person. I love to work out. I love to move around. So when I realized that this was happening, I had to take accountability for myself and my actions and schedule time to step away, take my lunch, take my break, walk, run, ride a bike, do something of that nature that will allow your blood to start circulating, you to be in a better mood, and you can come back to your computer refreshed and able to engage in conversation with your coworkers to complete what you need to do.
Okay. Thank you.
You're welcome.
And just to add, it's definitely important to set that schedule and make sure that you stick to it. Use those. I know for me, my organization has us using Microsoft Teams. I make sure I put that I'm out offline, not available, do not disturb, so that I can take that time for myself to take a lunch break or just like Ms. Joseph said, just to walk away from the computer so you don't feel like you're tied to it. I know it's also important to schedule things after work so that you have something to do afterwards so that you can pull away. Because sometimes I'll notice, if I have nothing to do after work, I'll keep working. And then another suggestion would be to designate a place in your home so that you know where you work, so that you're able to make that your office space. And so that when you do walk away, it's not just, at the edge of the bed or on the couch or, it's that specific office space.
Really good that you said that, because there were some suggestions put out and they were saying when you have certain meetings, like for us, there are some meetings that you may not be, and the main proponent of that meeting. So there's one that, it's a daily, they call it the daily scrum. And it's me overseeing, the teams and hearing what they're doing, but I'm not a key contributor unless I have really something important to say. And what I would do is my headset's on, I'm called in, and I'm going for my little speed walk. And I walked about, by the time they finish, I'm like 3 miles in. So, and I come back to come back home. The weather has been off and on, so I don't do that as often. It's cold here on the East Coast, but that was something that I did religiously every day. I made sure to get my 3 to 4 mile walk in, and I used that time to do so in the first thing in the morning. So there are ways you have to be creative. There are ways that you can still have your work-life balance, still be accountable for what you do at work, but it's just all about knowing the timing and not sitting there saying, "Oh, I'm going to do more work." And we all do it, but sometimes lunchtime, I'm like, oh, what is lunchtime, right? I still drink shakes. That's just me. Make smoothies and stuff. That's just me. I'll take, it doesn't take 30 minutes to drink a shake, but I might do a 15-minute workout or something like that, just to get it in, or, just to have my blood flowing and moving around. So, I mean, there are things you can do that do not require you to go out of your comfort zone or norm, and you can still be available to check in on if you are one of those people that are scared or think someone's going to ping you during your lunch. You can still, have your computer close by and do what you need to do.
Teresa.
Go ahead, Teresa. Go ahead, Teresa.
Yeah, I think the discussion is very important. What I found out is, I think it was mentioned during the presentation by Ms. Joseph, the organizational culture, that need to the mindset. There should be policy and procedures by the organization, because the trusting relationship in some aspect with employee versus employer is still lacking in Telework. And that is because some employer, they don't feel employees are doing enough. But with my experience with COVID, some are putting in on an average of 10 hours as opposed to going to the office to perform an 8 hours work religiously and come back home. And why am I saying this is that there should be building relationship, mutual understanding and mutual respect for both the employer and the employee. And I joined specifically, somebody invited me at the local health department, and the stipulation were like, you have to be visibly on a WebEx, and which is great because you're on clock. But the question is, how many minutes of break did they give? They gave only 30 minutes of break. And you know too well, if you are in the work environment, you can get off some time out of your desk and walk around, and you're still on duty. But with WebEx or telehealth, they want to see you live, just like we are now. And this stipulation needs some changes, mindset, organizational culture, and value need to adapt with the 21st century and COVID-19, because I've seen it on both clinical side and I've seen it on administrative side. I think the organization need to set some strategic operational plan outside of the previous years or 20th century.
That's a good point that you just mentioned, Dr. Aleze, because I think Dr. Henley just touched on this too. Again, like when I started discussing the health impact, I mentioned that the telework may not apply to a lot of organizational settings. So now for the areas where it applies, I think even, I don't know the stipulations, right? But even when they want you to see you live, I don't know whether it will be against the company policy for you to actually go live while you also working, like Dr. Henley just mentioned, because you can still go live and still do your physical activity and take a walk for that 30 minutes and come back. Now, if the type of meeting setting will not allow you to do that, because you might log into your computer, you have to go to the organizational command drive to do certain work, then that's a problem, and I totally agree. But again, you have to treat each situation with a specific condition to see how you can mitigate that environment.
You know, Dr. Amalu, that you made a good point, but I think back to it really does depend on your organization's culture. I've been in meetings when people say, you know, I'm driving right now. They're a key speaker. They're driving and they can't get their to the data to, you know, they'll check when they get back to their desk and let everyone know. And it just seems okay, you know. And sometimes I'm like, it's mind-boggling to me even, because if I'm a key person, you know, I'm making sure that, you know, I'm here and present and I have the information that I need to convey to the people that are there. So it's really funny how the organization, you know, each organization's culture works. And I think that's what it boils down to. You have to start there. You know, it can't be something mandated across the board of all federal government. It's going to have to be individual entities that we work at first to get them aligned, and then go from there. You have to understand the expectations of your organization.
And also, mind you, I need to say something very quickly. In this discussion, we never touch on security. So that's another topic. You know, for example, people that work in medical field, you know, whenever you see a patient, you have their social security, you know their name, you know the medication they're having, and then you know their medical condition. You put everything through EHR. Again, you know, that's why this is very slippery slope for medical practitioners, because there are certain work environment you're gonna be in, and you have all these sensitive materials. How does it play out? So organizations also have to account for that and make sure that, yes, we want to support telework, but we want to do it safely so that we do not also put our clients in a dire situation and put ourselves in a legal issue. So those are, again, coming back to organizational culture and organizational setting.
Right, and that's a good point when you're talking about those type of instances, because that's what telehealth and telemedicine do. There are platforms for specifically for those type of things that do have the securities in place. And I think that we do need to deep dive more into those, you know, those type of professions and aspects of telework / telehealth and medicine in our near future to coincide with this discussion as well. Are there any other comments or questions?
I had a couple comments if there's still time.
Yeah, go ahead.
Yeah, so going back to maybe the isolation topic, I think, you know, where we're seeing people that are either struggling with isolation over the telework or they're not, it's really a matter, I think, of personality. You have introverts and extroverts. So you got people that are flourishing right now.
Right.
You know, they get to just be at home and doing nothing. And then you have extroverts that are, you know, they get energy from being around other people, and so they're not getting recharged. And so I think that's one of the things that you're seeing with that kind of loneliness component. You know, seeing extroverts are suffering from that. Another thing is the you know, everyone got thrown into this you know, working from home, this remote work, and so you're seeing, you know, kind of like a technology competency coming out. You know, you're seeing someone in their mid 50s versus their mid 20s. You know, that might be a big difference. You know, if you have 20, 30 years experience working in an office in person, and all of a sudden you get thrown in to this remote work where you got to be able to navigate, you know, a computer and work over email, you know, versus in an office environment, that might, you know, you might struggle with that, you know. So people are getting thrown into things that they either didn't sign up for. You know, maybe they signed up for an in-person job, and then now they're having to work completely remote, and they just might not be prepared, or that just wasn't what they were signing up for, really. And I think the other comment I wanted to make was, or no, I think that's it. That's it. So.
Thank you,
Andres.
You brought this up because 2 days ago I was discussing this with Dr. Haley. I said, you know, look at introvert versus extrovert. So thank you for bringing it up. We kind of like skimmed through it. We didn't discuss that, but that's a very big part in this telework environment.
And what's funny is I guess I'm just the oddball because people that actually know me, I do consider myself an extrovert. Miss Josephat, what do you think? And I'm fine with being home. I think I've overused Zoom so much, and maybe that's what I did is compensate for me not being in front of people. But I do have those moments where, you know, even at work, where I'm just like close myself in, don't talk to me, headset on, I zone out and I'm just strictly getting my work done. So I was just explaining because this guy on Friday said, I wish I was on your team. You guys seem to have so much fun. And I said, no, I've pushed the work hard, play hard mentality. So, you know, we will spend maybe a good 3 or 4 days or a week or two or whatever the project is, and we are heads in the sand, and then we are chilling, and the world is thinking, wow, they don't do much, and we're playing at the beach, you know, kind of mentality. So it just depends on, you know, how you, and you know, yeah, my team is like, yeah, we're having a party, you know, we're just chatting about nothing, movies or whatever we're going to look at over the weekend, or, you know, making tacos or, you know, whatever, passing recipes. There's been instances, I have people that live close by me, and we do the COVID drop and deliver. I'll drop off some vegan cake because somebody wants to try my vegan cake, and then they'll drop off, you know, some pumpkin roll or something like that. We do this. So it's really funny. Or, you know, coffee runs, like, we're not going to hang out, but, you know, let's do a coffee hour or whatever. And we just chit chat, you know, and we make it work for us. And I think that part of my being an extrovert, it comes creativity too. So it works for me, and I love it, honestly.
Oh, and I'm remembering the other comment I had. The other comment was about how the environment that we're in really kind of brings out a different person sometimes. You know, so when you're at work, you know, you're whatever position or title you are, and then when you're at home, you know, you're either husband or wife or your mom or dad. And so if you're now people are working in an environment that they normally were, you know, in their leisure, you know, they're in the same environment that, you know, if their office is in their bedroom, you know, they're working in the same environment that they typically are resting in. And so sometimes that can be hard to have that transition happen where, you know, you have to be in a work state of mind, but you're in the normal environment at home where you're not, that's typically not people's work environment. And so, you know, trying to flip that switch sometime, I think can be a challenge, you know.
Yeah, I purposely get up, get ready for my day. I do work with people that actually dress. I don't dress for work, you know, but I do. I do make sure, you know, this part is good, you know, in yoga pants, whatever the case may be. But I do know people that will put on hair done, makeup done, no, a suit and everything, and carry on their whole day that way. And I commend those people for that.
Mm-hmm.
You know, I think that honestly, you know, as far I've cut out time getting ready, so it's just not a thing that I care to do at this point, you know.
Well,
but
yeah, that's definitely one of the things that they've recommended to people that have that maybe struggle with that kind of switching into that work mode is do what you would used to do when you went to work. You know, you got up, you got dressed, you're wearing your professional clothes. You know, you didn't just roll out of bed and turned on your webcam, you know.
Right.
So yeah.
I don't do that. I'm not. I'm always camera ready because, you know, I do have customers that, you know, they're like, oh, hi, Tasha. It's nice to see your professional picture. And then I'll turn my camera, I go, how are you? And they're like, oh, and they light up. So I gauge people and how they're feeling too. And I just flow with it, you know. If you're okay with not the cam or you prefer not the cam, then I'm not going to be on cam, you know, as well. But if you're one of those people and I know that you need that interaction and feel like you're close to me when we're having a conversation, then I will turn it on.
Yeah, that was it for me. That was it.
Thank you.
Thank you, Andres.
Before I close out, I always like to ask is there anything else that anyone would like to say?
Yes, this is Felicia Haddon. How you doing, everyone? I can agree with everyone comments that have been mentioned. I am currently teleworking from home, and I would actually agree with the statements in regards to working at home. It all depends on your organization. The organization that I work with is kind of paramilitary structure. And even though I'm more administrative business and dealing with training and recruitment aspect, I find it very hard and difficult getting up because I'm more active when I'm at work. I take my breaks. I have my reminders. I have my phone alerts. And I notice even though I have my phone alerts, I find myself being stuck and glued to the computer. I find it's not efficient for me. I like the whole structure of working at home. However, I find myself being forced to work, and not get up and have my breaks.
Yeah.
Sometimes I get up, and then I think it also depends on the dynamics of micromanagement, the style of the manager. We had a lot of transition, so I see the work environment for me, even though they say, it said earlier about it's prone where people have taken this opportunity for promotions and stuff like that. I've been trying to make a transition out of my work environment because I know my personality and my structure of people-oriented is not geared for the type of work I'm currently doing. So I know the physical activity and more stress, for me, it has become more stressful because I find myself trying to constantly be performance-based or try to be more productive. Even though some people tend to procrastinate, I find myself wanting to stay and work even after hours. So my hours may start at 6:45. I clock in and I go all the way until 6 o'clock when that's normally not my regular working schedule. So I like this platform where you get all the information, and it's also helping me to engage and get more information to help assist me in my day-to-day life. So I really appreciate this platform and engaging and getting information. So I just wanted to thank you all for providing this opportunity to give the information.
And thank you, Felicia. We appreciate you as well for your contributions to our platform and, as we move forward. And we always say from Public that if you have any additional questions or you want to brainstorm anything, we're always open to that. You can just shoot us an email at thepublic@gmail.com, and we'll be very happy to further any type of discussions that we've had, because we're all about healthy discussion, healthy people, and then if you're a healthy person, you can help create healthy communities and environments. So that is very important to us. If there are no more comments,
I'm going to take an opportunity to send information, questions, because I took a lot of notes and
okay.
I had more questions, so I think
Please do. We want them. We want them. We love this. We love this. We love answering questions. We love, having these discussions. Dr. Amelie and myself, we powwow weekly, 1, 2, 3 times a week, having these type of discussions and sharing research and stuff like that. So we welcome our community members to Public to engage with us whenever you feel the need. We don't mind. And we want to promote that. So thank you so much. And we thank everybody who attended and participated in this discussion. Again, thank you so much to our wonderful presenters, Ms. James and Ms. Josephat. We really appreciate you, and we hope that you join us again in the future to elaborate on your research that you're currently working on, deep diving into specific aspects of telework. I think that's going to be very interesting in the future to hear what they have to say as we all move forward in this pandemic and eventually enter the post-pandemic stages.
Do not
Go
forget,
ahead, Dr. Amalu.
yeah, and please do not forget to follow us at Instagram or Facebook. Just search for us, the Popaholic, and follow us. We share resources. All the resources that we discuss right now in this show will be shared in our website under Resource tab. You're going to see all the resources for this particular topic. So if you want some information, just go there and you're going to get all the resources.
Yeah, we'll make sure to have those up this week, as well as the resources for our previous shows that we did. And also, we do encourage you guys to follow us on Instagram, because from time to time, we've made a decision that we will be going live to talk about issues at a high level and to gauge what you would like to hear. So, and if there's something that you would like to speak about on the platform, we do encourage you to reach out to us and have that discussion so that we can be there for you and support any ideas and pressing topics that you would like to hear Popaholic address. So with that, I will close out, and thank you again, everyone, for attending. Bye-bye.
Bye.
Bye-bye. Thank you.
Bye. Thank you. Thank you.